I'm working as a healthcare assistant at the hospital, NHS. Oh, it's a two-way thing. I'm supposed to sleep. I've been doing night shift for the past 7 years.
Wait,
Yes.
Just wait.
You can survive. You can survive. You can survive. The best thing is to be patient. That they will give you the best support you can ever have.
Hello everybody, welcome to my channel. My name is Amaka, but you can call me Miss Maki. If it's your first time to see my channel, do also click on the subscribe button so you can be a part of my local community. Today I have a guest with me in the person of
Grace Azoji.
Yes. So we all know that everybody has been trying to come to the United Kingdom via the health care assistant route where you get a tier 2 skilled worker visa. So today, Grace is going to be telling us everything we ought to know. So if you haven't subscribed to my channel, please do well to subscribe to my channel right now. So Grace, can you tell us more about yourself, where you're from, and what you do in the United Kingdom, basically?
Okay. Yeah, my name is Grace Azoji. I'm from Enugu State, but married to Imo State. So yeah, I've been here quite a long time.
Okay.
Yeah, with my husband. I've got 3 kids.
Oh, nice.
Oh, yeah, thank you. Yeah, I'm a healthcare assistant in England now for the past 7 years.
Whoa, I didn't even know that.
Yes. Obviously, the first time I started my care assistant job, I started in a care home.
Okay.
The care home will give you the variety of all the things you should know about healthcare assistants, because you have people like have a complex care.
Yeah.
You know, you just have like elderlies and things like that, and you need to like care for them. And I've worked with learning disabilities as well. I've worked with advanced dementia.
Really?
And yes.
That's like an experience you have there.
Yeah, and I've worked with end of life care as well. So and I've worked in community, and presently I'm working as a healthcare assistant at the hospital, NHS.
Okay.
And moving forward, my final year as a nursing.
Wow, congratulations.
Congratulations.
Yeah.
Thank you.
Yeah. Okay, so you've spoken about care homes, mental health, different types. So that means you have experience everywhere.
Yeah, I do.
And then you now said now you're a nurse going to your final year.
Yes, yeah.
Okay. So how are you able to manage that, like within the past 7 years? You're working in care homes, okay, now in a hospital, right? As a care assistant.
Yes.
And then you're able to further your study. How did that happen?
Yeah, I started from scratch though. So
Okay.
from care home. So when I started there, they have like some of training you need to do, because I don't have any experience about a healthcare assistant, because back home I studied statistics back home in Nigeria.
Really?
Yes. So I don't have any. I'm not into the care line.
route. Yes.
So they put me into to do some training like care certificates.
Okay, like which one? Which can you remember any one of them?
I did care certificate. It's just like
General.
where
Okay.
you have everything.
Okay.
I went for training for moving and handling, because you can't assist a patient that uses a hoist into a commode if you haven't had any training on moving and handling.
Okay.
So
yeah.
before you do anything, they will take you to do moving and handling before you can able to work as a healthcare assistant. And some other ones like food and safety, to know how to handle food in a care home.
Okay.
Even infection prevention control, because you have to know how to do your hand washings, or how to put your aprons and other things.
Okay.
So you just have to like go for training and all that.
Okay.
So I did that, and I did MVQ level 1 and level 2 and level 3.
Okay, I was going to come to that, because now all the jobs that have been advertised, they always talk about NVQ 1, 2, or 3.
Yeah.
Now this NVQ 1, how long can someone take the training for?
They're like mine, because I was working in the care home.
Yeah.
So some of the training I did it there, and they have some people that come into the care home.
Okay,
to
right.
do it for you people. Like they have like branches. So if I'm like in branch A and branch B, people that will sponsor people to come in to train you. So they have to put everything together, then bring you in and you do the training. So sometimes it takes months, and you have somebody that will assess you. Then you do some workbook and things like that to give it to the person to like, you know, assess your progress and see where you needed help.
Okay.
So yeah.
All right. So is it possible now that people are in their different countries that want to do this NVQ certification courses? Can it be done online, or it has to be physical, like you have to be there?
No, some people do NVQs online.
Online.
Yeah.
Okay, so because people are really planning to come to the UK via this route,
Wow.
and they don't have the certificate, and some people are trying to go a step further to acquire the certificates, so they can be done online.
Yeah, it can be done online. Yeah, NVQs can be done online.
Okay, that's good. Okay, I was also asking now, how are you managing to work as a carer and also studying for nursing?
Yeah, I know. It's a two-way thing. As a healthcare assistant in the hospital NHS, I'm working there, which is good because it's flexible for me because I've got kids, you see. So if I want to work a night shift and finish half 7 in the morning or 7, so I can come back and do school runs, it's fine for them. But if I'm with agency, it's quite difficult because with agency, if you're starting 8 in the evening, in the night, you have to stay to the finish of the shift.
That's how many hours?
That's like 12.5 hours.
Wait, 12.5 hours?
Yes, that's what it is.
Do you have break in between?
Yeah, we have an hour break.
Okay, can you sleep within the 1 hour?
It depends on the trust policy you say.
Oh,
But yeah, some people will just is 1 hour is mine. I've got to do what you got to do. But if you remember, you are working for a trust, and there's a policy regarding the breaks. So actually, you're not supposed to sleep.
Not supposed to
Because there can be emergency, they can be a cardiac
and
arrest.
they just need you there.
They need you there, so you need to just go and help and intervene. So you don't actually sleep.
So now, with your wealth of knowledge, working in a care home and working with NHS, which would you advise people who are coming into the country to look out for?
I will say because first of all, you see, it doesn't matter if you go into NHS, but NHS will need you to have like level 2 in English and maths, because if you're coming from other countries, the qualifications are different.
Yes,
you see.
true.
So you need to have English and maths level 2. But with NHS it's the same thing, but with agency it's quite different because agency will just put you there at a spot. Yeah, agency would just go register. They'll make sure they give you the training though, but they don't require all those things like level 2 in English and maths and things like that.
Yes.
But NHS will require that.
Require all of that.
Yeah, they do require that, and you need to like have it. Then if you have other qualification, you show them, you will still get into NHS.
Okay.
But some people, I would say, certain points.
Care homes. Okay.
I would say care homes.
Are you guys hearing? Care homes is good, so you should start making your application.
So care home is fine because it's going to get you more exposed. Then from there you can find your way into the hospital settings, which is fine. So why I'm into the hospital setting, because I'm doing nursing now, and it gives me the more knowledge that I needed as going to be as a nurse in future. Because I'm going to see like lots of things in the hospital rather than in care home. And as well in a care home as well, it's good because you go to like see it's elderly, some people. If you're working with learning disabilities, you know how to manage them. Advanced dementia people and so on and so forth. Because what we see back home, some people are say, oh, they're in the street, they're mad. Some of them here, you don't see them in the street. It's just like anxiety, depression. So they have all the medication they give to them to like help them and control those symptoms and all those illness they have that triggers it to like
get to that
level.
Yes. Okay.
So care home is fine.
All right. Now, some people are also trying so much to come to the United Kingdom via this route, and then we already know that the absolute floor payment is £20,480 annually. Now, can they survive with that salary? As a carer, many of them are coming as single people. Yes. So is it possible to survive on that salary if you're coming through this route? Yeah, it is. Because like me, if I'm like off from school, I can do 4 nights in a week. Okay. So and per hour, it depends how much per hour they are paying as a trust. And if you're a band 2, then we have band 3, and they have band 4, and they have band 5. So band 2 is a healthcare assistant, depending on the trust. Some trusts give band 3 as a healthcare assistant. Then band 3, they have it like in A&E, they have it that those people that do like plastering, stitches and things like that. Yeah, so those ones, and as well they have band 4, the nursing associates. So band 5, the registered nurse, which is the the one. So you can survive. You can survive. And when you're working with agency as well, agency pay more money. Oh, like how
yeah.
much? Like how much per hour? What's the least you've ever received?
Oh.
Like working with an agency per hour?
Yeah, if agency working in a care home, some of them can pay you £12 per hour.
Okay.
Yeah, but if you're working as an agency under NHS, some people can pay you £16 or £18 per hour.
That is so much.
Yeah,
That's so much.
as a
so
health,
good.
yeah, as a healthcare assistant. So when you multiply it by 12.5 hours, maybe say 11.5, obviously
Your break is 1 hour. Yeah.
So that, which is not like too bad, you see. So yeah, but depending the agency and depending where you are as well. So because of some areas they have like high demand, they pay more, and some agency pay more depending the agency you are with.
You find yourself with.
Yes.
Okay. I think that sounds good and encouraging.
Yeah.
Now, what about the difficulties working in care homes that people are likely to encounter? Because it's not about getting a certificate of sponsorship.
Yeah.
You need to know what you're getting yourself into. Now, what are the likely difficulties that they could face? And how do you also best advise them that if something like this happens, how they can circumvent it so that they don't find themselves losing this sponsorship?
The best thing is to be patient. There is some, things, language barriers, you see.
Yes.
Because where we come from, our side here, sometimes you cannot hear what someone is telling you or speaking to you about. You just be like, oh, what? So you just have to be patient, just not calm, relaxing, and just not like freaking out all the time. Oh, what is this person doing? You just have to like let it flow, because it's just like learning progress. You just have to take things at it is one at a time, stages by stages. So, and as well as asking questions, you see, anything you don't know about, you can easily, how do I get this thing done? How want to do? But if you just leave it on your own, I'm scared, that's when you put yourself in awkward position and more difficult for you as well. You see what I mean?
Yeah.
If you're not sure of this patient, looking after this patient, just ask, please, can you tell me, how to do this? So I'm finding it difficult to help these patients, to put this patient in a commode, because we've not done it back home, you see.
True.
But here, you have to do it. I want to change this patient, but I don't know if I need assistance of two or things like that. You ask, so you don't find it difficult to struggle to do this on your own, and you end up making mistakes that will lead into somebody's life or make somebody fall and they break their hip or ankle so that will not even trigger the whole thing. So it's always good to ask questions. So but otherwise there's not much difficulty.
There's no more difficulty.
No, I don't think there is that much.
Okay.
Because they will give you the best support you can ever have.
Amazing.
Yeah, you get the best support.
Okay, so Auntie, I'm so concerned, like how you're able to juggle your time working and schooling. It's not really easy, especially nursing, where that it's practical. Yeah, so how are you able to juggle your time? Is it really going smoothly for you?
Yeah, it is, actually.
And probably the fact that you have a family.
I know. I am 2020 cohort. Exactly, I started September when the COVID hits.
Okay.
Yeah.
Okay.
So that time we're as for now, we are still doing blended learning.
Okay.
But we go to school to do our practicals. To do things. But we do our most of courses at home.
Oh, right. Okay.
So when the kids are in school, I'm at home learning. You see.
Oh, that's
so
good.
I work. I school Mondays, Wednesdays, and Friday. So in between those days I'm off, I can go and do a night shift. I've been doing night shift for the past 7 years. Yes.
Just wait. So I do. Wait, you just say night shift for the past 7 years.
Yes.
Like just night shift.
Yes, I don't do day shifts because of the circumstances beyond my control. Because of the kids. Because I have 3 kids, I have to take them to school, bring them back home, do this, do that. So I have no option than to stick to a night shift.
Wow.
Yes.
That is wow.
Yeah.
Like night shift.
Yeah. I
think you're a very strong woman.
And what else can you do?
Yeah,
this country will teach you how to be strong.
Yes, I'm already experiencing that, so I can really tell. Yeah. Okay, so now your experience as a carer, would you say it has helped you with your nursing career?
It has, my
A lot?
A lot. 1001.
Really?
Yes.
So it's best that people who plan to continue as nursing or healthcare routes, that they should come in as carer is a stepping stone for them.
Yes, it is. It's really, really good.
Okay.
Because and it's quite different from back home. And here as well, as a healthcare assistant, there's things you got to do. There's things you have to do. Like the trust have policy. Your job descriptions are always there for you.
Okay.
You see, as a healthcare assistant, there's things I should do. You are not just there to change pad. You want to progress, to do something else, you can progress. If you want to be trained as a healthcare assistant under AMU or AME, you can get such. Or you have to ask and get that experience. Like me, since I started working in the hospital, I see the difference to when I'm working in a care home.
Care home,
you see what I mean? So there's a lot to learn in the hospital setting.
Okay.
Yeah, because they give you all that. But the care home, they will, but there's no much in there for you to learn. So some of them are limited to what they will do. Like if I'm still in a care home now, I'm not allowed to check blood sugar or give insulin to diabetic patients.
Okay.
You understand what I mean? But in the hospital, like in the district nurses, they have band 3. You can do all that for patients because you go out to visit those patients.
Okay.
You check their blood sugar, you give them insulin, and you have any concern, you just have to raise it to say, oh, I have concern for this patient. You can call 111 for help, and if this patient needed more help, that this is not what I'm going to do, you just say, oh, that's why you're band 3 or band 2 on that community. You just have to help. Yeah, but in a care home, district nurses go into there to do all those things for this. So in a care home for them.
Yeah, okay.
But in the hospital, we have nurses there to do that for the patients. Then as a student nurse, I'm limited to what I'm going to be doing as well. You see what I mean? But all those things is enhanced me a lot because I've come from care home to hospital.
Migrated,
so
now.
Those things, so it's
that's very good.
It's quite good.
All right, so Auntie Grace, we've learned a lot from you today. But what can you tell people, like a take-home word of advice for them, people who are making so much effort to come to the United Kingdom as healthcare assistants?
Yeah, my advice would be you don't have to it's good to come in and have the experience, but don't rush yourself. Okay. Don't be oh, I really want this. Yes, yeah, I just this. No, you just have to let it work smoothly. Make sure you went to the right source, because some people will go just out there to rip you off. You say, I have the right link, I have this, I have that.
Sorry to cut you short, because I made a video on that about how people are falling prey to swindlers. Out of desperation, you fall into the wrong hands, they just scam you and take your money, and you will never, when I say never, make it to the United Kingdom. No. So it's always good to follow the right route, just like she's telling you right now.
Yeah, it's true. Some people will go and just chrome and get the link, and when you open it, you just say, oh, wow, yeah. No, they have the things step-by-step thing to follow.
Yes.
But some of them don't even know it, and they just come and tell you, oh, I've got it, I've got the right source, just because they want to eat your money. Anything you want to get, you go to www.gov.uk.
Yes.
You get all the information.
Yes.
It's there for you.
Yes.
Yeah, it's just there for you to see. You don't need someone to tell you, oh, give me this, I'll get you this. No, it's just there. And you can even do the application by yourself at home. All you need is just to know the requirements.
Exactly.
Once you know they can do it, you don't need someone to rip you off just because you want to come into the
country.
No, you don't need that. And some people, they want to implement it, but I don't think they are doing it now. They care homes to if they require someone, they can be the one to sponsor such person to come in, because
they are sponsoring now.
Yeah, okay.
Yes.
I know before they said it, and some people, wanted to make move. Sometimes, all those things changes. It just need more updates.
Yeah, exactly.
On that, which is not bad. If you have someone that is genuinely that say, oh yeah, I know a care home that sponsors someone, but you have to make sure it's from the rightful source.
Thank you.
That's the main thing.
Yeah.
So,
all right, thank you so much. I'm sure we've had a lot, and then we're going to digest it and implement every bit of information you shared with us today. Thank you so much, Auntie Grace, and I'm sure every other person out there is grateful. We appreciate you, and we hope to have you sometime again on my channel.
That would be nice.
So in case you have any question, you can pop it in the comment section, and she's going to do her very best to answer you. And I wish you guys the best in all your application, and I hope to see many of you in the United Kingdom.
Yes.
Thank you so much, Auntie
We'd
Grace.
love to see all
Yes, all of you. Your efforts is definitely going to count.
Yeah.
All right, Auntie Grace, thank you so much.
Thank
All
you.
right, yeah. So if you haven't subscribed to my channel, do well click on the subscribe button so you can be a part of my community. And guys, I'll see you in my next video.
Bye.
Bye.